Hey everybody, and welcome to the 10th episode of the AskDrG Show. This is the show where you ask the questions and I answer them. Today we have a really special episode. A lot of very applicable and very needed thoughts that revolve around patient care. And then the final topic of the day is something that I want to talk about, and it revolves around a certain movie that I am very passionate about, but we'll get into that at the end. The first topic of today, I put out a tweet about 2 days ago that had garnered some attention with some of the medical professionals that I follow. And they were, saying how much, this message needs to get out more. How patients are uneducated about this concept, and if they understood this premise about the human body, healthcare would be a whole lot easier. Part of the tweet said, patients want to hit that proverbial healthcare easy button where when something goes wrong, like, oh, go to the hospital, fix it, boom, hit the easy button. And then I'm done, I'm back to normal. And that's how we treat, healthcare in America is just as a get out of jail free card. And I can preach wellness to patients till I'm blue in the face. People don't associate with wellness as one would think someone would associate with wellness. You would think someone would say, yeah, I want to prevent me from getting sick or injured or whatever. But that's not the case, and here's why. Healthcare has just gotten so frustrating and so expensive that people try to avoid it altogether. Like, there's no desire for people to want to have to go to the hospital or to the urgent care or to your primary. You're just like, the least I need to do it, the better. And that's most people's approaches. The problem is that gets into the psyche of avoiding healthcare or health-related issues altogether. Now, I'm painting with a very broad brush. Not everybody treats their health like this. There's a lot of very healthy people out there that are, working out on a daily basis. They're eating healthy. They're trying to keep their kids healthy. All of those things. So this isn't everybody, but the vast majority of people see healthcare and medicine as an emergency easy button, as I like to call it. But they're the judges of when they go and access healthcare. The last part of the tweet said, if you can tell something is wrong with your health, you've probably waited too long. What I mean by that is, patients aren't trained to know little nuances in the human body, in the physiology, and how the body's supposed to operate normally. Before I went to school for this, I had an idea of what healthy was, but I really didn't know until I got trained to look for those subtle nuances in how patients present to a clinic. And so, most normal patients, they're untrained, and this isn't a knock on patients, but most people don't access healthcare until they sense something is wrong. Okay, you have high blood pressure, and you wait until you have a hypertensive episode, or you have high blood glucose, and you wait until you have either a diabetic coma or ketoacidosis, all those things, and you wait until there's a health crisis to know or understand what you need to do, and that's to access your doctor and get some help. In my world, people don't come and see me for little aches and pains, except for a few people that I've been able to educate and say, listen, it's a lot easier to fix you when it's just a 2 out of 10. But people wait until it's a 10 out of 10. And I've got the next topic, we'll get into something that really fires me up about accessing doctors for pain relief. But that's neither here, that'll be there. I, I find that the more I talk with patients, the more people are starting to change that mindset away from just like waiting to get sick. Like if you're just waiting to get sick and you have your insurance card as, whenever this body breaks down, I'm going to just go to the hospital and use my insurance card and it's going to be paid for. No, it's still going to be very expensive to go to the doctor, even if you don't do regular checkups. It's going to be probably even more expensive. Acute care and emergency medicine is the most expensive medicine because it's saving your life most of the time. And I was talking with a couple MDs, and they were saying something to the effect of, yeah, patients wait until they know what's wrong, and then they question your recommendations when they give it to you. And I'm okay with patients being educated and having input, but if you wait until you start to feel symptoms or you start to feel signs, your body's already compensated and been fighting that original illness or disease long before you sensed it. Something as simple as, high blood pressure due to stress, that's pretty normal in a lot of us. A lot of us, our blood pressures are raised, but what if it was chronically raised? Okay, or our body would start to compensate elsewhere in the body with the sodium retention and all the systems in the kidneys. Like the body's compensating to find homeostasis, but a lot of times it compensates pathologically. It's a normal physiological response to have high blood pressure. High blood pressure is not in and of itself a diagnosis, or it's not a disease. It's a disease when it becomes chronic and unresponsive to any type of medications, any type of strategies. But by itself, the body's not just going to raise blood pressure because it feels like it. It raises it due to stress or inflammation or injury or diet, or it could be a whole host of other things. But if left unattended, that high blood pressure becomes something that you're going to understand is a real problem, and you're going to have a higher risk of stroke, heart attack, all of those things. And by that time, it's too late. A lot of times, people, the first, symptom of a heart attack is a heart attack. But we would have known if you had high blood pressure or chronic inflammation in the arterial walls. There's things that can be done to prevent those things if they're caught and managed early before you have any symptoms, before you feel any different. In my world, my analogy that I always use is when someone has searing low back pain on the right side, on their right hip, I usually don't look at the right hip first. A lot of times in the low backs, you get a compensation, a crisscross pattern in the low back where the main issue's over here, but the body compensates with really tight muscle spasms and it locks everything down and you just can't move. You're tight. You're feeling like it's on this right side, dog. Why are you touching my left? I'm like, no. That's the compensation. You waited until the compensation, but you were feeling stiff on that left hip for a while. Oh yeah, I was. Or I landed on my left hip weird, thought it was okay, but I just shrugged it off and took some Advil and it was fine. The pain went away. Well, your body doesn't really forget that just because you popped in a couple, Advil. You've got to, make sure that hip is working properly, or else it will transfer and the body will compensate to the opposite side. So whenever patients come to me and, I do my thing, I figure out what's going on, it's always funny when the patients ask, why are you looking over there? And I'm like, well, this is how the body works. You're feeling the compensations, and we've got to fix the root cause. And sometimes when people say you got to treat the root cause, people come across and that's like super granola, like, oh, you must be super holistic and, wave essential oils and crystals over people. No, like why wouldn't we want to treat the cause of the disease or the cause of the injury? Like, to saying treat the cause is not, shouldn't be abnormal, unless we're so used to just treating symptoms that's what medicine is now. That's a poor application of medicine if we just treat symptoms. And I'm not dogging any type of profession at all, because I treat symptoms all the time. You still have to, or else the patients aren't going to come back. If you're like, someone has severe knee pain, but you keep treating their hip, like, it might reduce their knee pain, but if you never touch their knee, they're gonna be like, this dude doesn't even care about me. Like, I told him my knee hurts, not my hip. Now, you can educate him and get him to understand, like, listen, it could be coming from your hip, and the biomechanics, closed kinematic chain, blah, 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 blah. It's coming from your hip. And then he's like, okay, we'll give it a chance. But if you just completely ignore that, the knee pain, he's not going to come back. He's like, you didn't even touch me there. Like, you didn't even get to the root where my pain is. So you have to treat symptoms, but that can't be the only management tool that doctors use, is just treating symptoms. So treating the cause should be standard practice nowadays. And I think a lot of doctors are getting really, really good at understanding that balance of treating symptoms, but, finding that root cause. So my encouragement to you patients that are listening, get checked. Like, it doesn't cost that much money. It's like a $60 copay. Sometimes it's less, to see your primary care. Just go get some blood work done. Go get a checkup. In our office, to get an exam on normal insurance policies, it's pretty expensive. That's why we started the prototype benefits package, where you get 2 free exams a year. Like, just go get checked. It's not a big deal. It shouldn't be expensive. It's not like you're committing to, $1,000, like, cause no one wants to pay $1,000 just to be healthy. Unless you're like super, super crunchy and granola and you're like, no, we're going all in. We're going, range-free, grass-fed beef, like, crazy, like, then $1,000 isn't a big deal. But I'm not asking you to spend thousands and thousands of dollars. I'm saying pay like 50 or 100 and just monitor it, because the doctors are going to be able to see little nuances and changes in your blood work, or I'm going to be able to see little nuances and changes in your posture, in your range of motion, in your flexibility, all of those things. Like, it's pretty easy. Like, it's not rocket science. And we like to make healthcare sound like it's, we're trying to send somebody to Mars. Like, healthcare is not hard. It's not complex. Like, I think in our culture, we put MDs and doctors and chiros and all these medical professions on this pedestal of like, oh my word, you guys are so smart. And I think we've earned that right. We've done a lot of schooling, but we're not, so much smarter than the average human. Like, we just chose to educate ourselves, go through ungodly amounts of debt and education to get a degree to allow us to help people. So I don't think we should be, making healthcare super complicated. Wellness and healthy living is not complicated. And anybody that tries to make healthcare complicated or, hard for you to understand is just trying to keep you uneducated. It's very similar to when, back in the Middle Ages, when the Catholic Church, the only people that could read the Bible were the priests or the Pope, and the parishioners couldn't read the Bible for themselves. And it's just a way of keeping people, uneducated and out of touch with what's going on. And that happens in healthcare, where we don't educate our patients as much as we could or should. And I think we need to do a better job at educating patients on how to sense when their body is starting to shift out of homeostasis or out of normal, before those compensations set in. Because if you're waiting until you feel pain or you feel whatever, it's too late, and it's going to take twice as long, twice as expensive, and it's going to be twice as frustrating. So go get checked. All right, on to the next topic. Topic number 2. Alternative medicine has had an interesting little news cycle in the last month. I get a lot of my news from Twitter. Twitter is instantaneous news. It is a lot of voices voicing their opinion on different news topics, and I like it better because you're getting everything. Like people that are, I mean, I could go to CNN.com, I can go to Fox News, and I'm going to get a certain slant on the news. Whereas Twitter, you know, who's ever got the most followers or whoever has the most engagements gets put to the top. So there's conservative voices that get put to the top. There's liberal voices that get put to the top. And same thing in healthcare. Like there's different factions that get put to the top because there's a lot of people that follow, you know, allopathic providers and holistic providers. Well, this whole story comes back to I think it was a journalist. He woke up with searing neck pain, burning into his shoulder, like unbelievable pain. And went to his primary, gave him prescription pain meds and muscle relaxers, and they told him to put heat on his neck and shoulder. Okay, so he takes the pain pills, obviously, you know, makes him loopy. He doesn't like taking them, but he does it because he wants to get the pain to go away. Puts the heat on, it feels great, it's soothing. Yeah, wears it, puts it on his neck in 30 minutes, and he's just like, oh, it feels great, I'm gonna go to bed. Wakes up the next morning, pain is like a 9 out of 10, like burning. Like, so he takes the pills real fast, puts the hot pack on, goes to work. Feels okay, burning still. By the end of the day, he's had a hot pack on for a couple hours. He's been taking, 8 rounds of the pain meds. And the pain now is closer to a 10. It's getting worse. So he goes back to his primary, and they just recommend a stronger pain reliever and muscle relaxer. Goes that for 2 days, getting worse. I mean, I don't know if you can get worse than a 10, but he was explaining how he was starting to get tingling and numbness into his hand. And if you're a physician, you know, if you've got radicular symptoms and it's going down your arm or leg, it means it's getting worse. And it was starting to creep into his forearm. He's getting muscle spasms in his arm, little twinges or tingling, I think is what he said, in his fingertips. And so the doc said, keep the heat on it, keep taking the pain meds. I'm going to prescribe you an even stronger pain med. So now he's at his limit, I think. And, he's not getting any better. He's actually getting worse. And he tweeted this. He said, in my last ditch, desperate attempt, I bit the bullet and went to schedule a visit with a osteopath. Dun, dun, dun. Like he's going to a witch doctor or something like that. He made it sound like, oh man, it was, I had to go out to Africa and find me a shaman. It's like, and that was the vibe that I got in the comments too, was like, oh man, you're lucky that you found a good osteopath. Like it's something that, it should be the last ditch effort. The osteopath was like, what are you, and he asked him, what are you doing? Told him I'm taking this, and this, doing heat. And he's like, whoa, why? And he's like, well, my doctor told me to, and it feels great. Okay, no, put ice on it. And he said within like 2 days, the pain went from a 10 to like a 7, and 7 to a 6, 6 to a 5. And it started to diminish. The osteopath was doing, I believe he was doing spinal manipulative therapy, which is basically what us and osteopaths do for the spine. I won't get into the science behind why that works, but his pain started just melting away. And he's just like, I've come to realize that, primary care, they're all over the place. And I trusted this guy wholeheartedly that he was knowledgeable, and he wasn't at all. And this isn't a knock on that MD. His specialty is probably family medicine and like spinal stuff. When it's not your specialty, I don't know anything about, what a gastrointestinal physician does on a daily basis. I don't know the insides and outsides of, the receptors and the immune function in the gut and the COX-2 receptors and like all of these things. I don't know anything about it. I know the names, I studied it, I know the blood supply and the nerve supply, but other than that, the function of it, I'd have to go back and really, really research it. Well, these doctors, we don't have time to go back and research. If a patient asks us, hey, if he asks me, what should I do for my heart? I'll be like, ask your cardiologist. Like I know enough to be helpful, but like if you're, have conditions and you have compensations and you have all this and that, and it's got this interwoven thing with your heart, don't ask somebody that's specialty is the spine and muscles. Like, and a lot of times chiros kind of get into where we think we're doctors of everything, and it's like, no, stick to your specialty. That is another soapbox. I will not get on that today, I promise. But his primary care was, as confident as can be, and, was telling him wrong advice, like completely wrong. And the guy just was, very frustrated. And he's like, I had this preconceived bias that getting a visit with an osteopath was like visiting a witch doctor. And I mean, osteopaths, it's basically medical school now. Like they can work in hospitals, they can prescribe, they can do pretty much everything. It's just a little bit different of an education. They get a little bit more holistic, a little bit more spinal. So they know a little bit more. And I wanted to comment and say, you should have gone to a chiropractor. You could have been better in like 2-3 days instead of it being a month or month and a half, and it's just, and I'm biased because I'm very confident in what we do, but I don't like the sentiment that when we ask our friends, hey, who's your doctor? And someone says, I go to an osteopath, or I go to a DO, or I go to chiropractor. People are like, ooh, why? Like, aren't you afraid like they're gonna hurt you? Or aren't you like, don't you want to go to a real doctor? Like, that sentiment is so 1980s. Like, people get results by athletic trainers who get, I think it's like 6 months worth of schooling. It doesn't matter the degree or the letters after your name. Like, schooling just gets you the degree. Education is what happens when someone that's passionate about what they're doing goes out and learns outside of school. That's where the real growth of the physician or the medical provider or the healthcare professional actually occurs. And like, I was at a conference this past weekend, and it was run by an athletic trainer, and it was unbelievable. The dude was awesome. So like, I know this because I live kind of in a biased world where it's like, oh, you're a chiropractor, like they kind of laugh. So like, I had no judgments for this athletic trainer. And he wowed me. I was like, dude, you're unbelievable. Dude, I would let you treat my patients. Like, I think you could probably help them. But we have this hierarchy that, you got your MD, and then everybody else is, got their education in the University of Congo. Those biases or those ideas are planted there. I think just over time, we just start to put this like immense, respect on the MD, and they're great, dude. There's some MDs that are like my heroes, and I wish I could be them. But I don't want to be an allopathic provider. If I did, I could go to med school. Like, if I put my mind to it, I think I could. But I just think there's a better way to treat people. But, even for this osteopath to have to go through that bias, like for that patient to have to go through that bias in his own mind, it's super safe to go see a chiropractor. Like, you have to go to the right one, obviously. It's just like hiring a plumber. You don't want to hire the bad ones to fix your pipes. You don't know that they're bad until they get there. So when you have a bad experience with a chiropractor, it's not all of us. And I actually spoke with an athletic trainer. He came in for an exam, and he's like, dude, I was really skeptical about what you're gonna do. And I was like, what do you mean? And he's just like, well, like, what you hear about chiropractors? I'm like, what did you think I was gonna do? He's like, well, I don't know, but there's like this like faux pas against, chiros. I'm like, okay. Like, did I impress you? Are you feeling better? He's like, well, yeah. I'm like, okay, that's your new experience. And I said, there's healthcare professionals, there's massage therapists that are awesome. So the overarching theme is, don't judge a book by its cover. Don't judge a healthcare professional by his degree or certification. Give them a chance. There's so many opportunities for healthcare professionals to work together. We don't because we're busy. We don't because we see each other as competition, not as teammates. And that's just part of it. But I really, really encourage you guys, if you're dealing with healthcare issues, especially like, I'm going to talk about my specialty right now, spinal, musculoskeletal, anything like that. This stuff is not rocket science, okay? I got a patient right now, went to her MD for 2.5 weeks, primary. Same story as what I was telling you earlier. She comes to me, she was 10 out of 10 for 2.5 weeks. She's already down to like a 5 after like 3 visits. It's like, we see these all the time, and I'm gonna write a report, like a journal report, a case study about her, because it speaks to the heart of, like, medicines aren't doing anything for the physical component. They're doing stuff for the chemical components in our body. They're altering the chemistry. They're not doing anything for the physical parts of our body. So that's my encouragement. Don't see alternative medicine providers as shamans or witchcraft, practitioners, whatever. Okay, moving on. Number 3, and this is my favorite topic to talk about, prototype benefits. All right, what is it? What does it mean? I have pitched this a bunch of times to different companies, not heard one bad thing about it, which is probably a bad thing. I probably should be getting some negative feedback to fix it and make it better, because it does need to get better. But in the same realm that dental insurance provides for cleanings, and you can get in there and get your teeth cleaned twice a year, we want to offer that to patients. And so I started building this policy, and for $10 a month, people can get 2 free exams a year. Pretty good. But we didn't stop there. 5 x-ray studies a year, $0 copay for both. All the x-rays, all the exams, 0. For any treatment that is necessary. The average cost, just so that you guys know, to come see us without insurance, sometimes even with insurance, to be honest with you, is in the realm of $78 to $114. So you're looking at that. We charge $50. $50 copay, paying $10 a month, and you get a bunch of visits in the middle. Okay, so that's what we're doing for our patients moving forward. The people that want to, like, some people don't want to spend the $10 a month for the entire year, and that's fine. They'll pay and I have a patient right now. She's paying $89 a visit, and I told her, it's probably gonna take me 5-6 visits to get you better. So she decided, she did the math in her head. She's like, no, I'm gonna just pay the $89 a visit, and I'll just keep paying that. I'm like, okay, that's fine. So she's doing that, but other people have taken advantage of it, and they're like, shoot, $10 a month, I'll pay 10 months up front if you give me 2 months free. And I'm like, sure, $100. So they're paying $100 for all these benefits. So it's really benefited patients, saving money. We're trying to offer something that's going to really tackle the issue in health insurance right now. I could spend 30 minutes on this, and I don't have the time, but health insurance is really screwing over chiros in chiropractic offices in 2020, and really they're screwing you guys too. You might be on your policy, have 20 visits, and they're only going to pay for 3 to 6. So it's like kind of frustrating, because then we put the bill on you guys, and patients get upset at us because they think that, well, I have 20 visits and you shouldn't be charging me. And then we're like, it's not us. I promise it's not us. But it is what it is, and instead of staying and playing that game in health insurance, we're gonna start our own. It's gonna be fun. We're meeting with businesses. We'd like to meet with your business, your clinic, your gym, whatever it is. We'd like to meet with you guys and see how we can collaborate and get everybody some benefits. Yeah, that'd be fun. Okay, the last topic. This is my favorite topic to ever talk about. And so many people are gonna think I'm weird. My wife already thinks I'm weird. But it's Star Wars. Star Wars: The Rise of Skywalker came out last night. And Me, one of my patients, and his sons went to watch The Rise of Skywalker at 10:45. We got out around 1:40. Had to be in the office here at 7:30. So didn't get a whole lot of sleep, but I wanted to give my spoiler review. So if you want to avoid spoilers, turn this off, go watch it, and come back. There's so much to unpack about this movie. This whole sequel trilogy has been really interesting to me. And I grew up watching Star Wars as like a 7-year-old kid. Actually, it was probably a little older than that. I was probably 10. Watching The Phantom Menace. And like, for me, the prequels was the first Star Wars I ever got introduced to. So I watched number 1, and I got to see it chronologically. I didn't watch it the way that, my parents' generation did, where it was 4, 5, 6, 1, 2, 3, 7, 8, 9. I got to watch it 1, 2, 3, 4, 5, 6, 7, 8, 9. And it made Star Wars make sense in my head. I wasn't confused at all. And watching number 1 at a friend's house, the Gardeners, I'm gonna throw their name out there, on a sleepover, and I was just so enthralled by it. And so I've been wrapped up since I was a young kid. Lightsabers, the Force, all that stuff. And I'm the biggest jock in the world. Played all types of sports, was kind of the bad boy in high school. But Star Wars was that thing that spoke to me on a nerdy level. And so this is my one nerdy guilty pleasure, is Star Wars. And so these new sequel trilogies, this new sequel trilogy has been really, really, really interesting. Though I didn't really like The Force Awakens. Like, I was like, yeah, it's good. Like, it was a Star Wars movie, so I was happy. But I wasn't emotionally attached to Rey. I wasn't emotionally attached to Kylo Ren. Didn't really care. I was emotional, but I was entertained. So I liked the movie. I gave it like a 6 or 7 out of 10. Then The Last Jedi, the most controversial Star Wars movie since Jar Jar Binks. And I hated it. I fell asleep in the movie theater. The Canto Bite scene, like, it was just bad. And like, I appreciate kind of like not following the same script as typical Star Wars movies. So that was cool to see something new, but like, it was boring. And that's just my opinion. A lot of people love it, but I just thought it was boring. So I was really disappointed and kind of like, lost in Star Wars for 2 years. It sounds stupid. Like, it's just a movie, but I could not wait for this movie to come out. Number 9, Rise of Skywalker. So I'm driving over to the movie theater last night, and I'm listening to Duel of the Fates and Rey's theme and the Force theme and the opening crawl and like all of these things, and on my way over there and just getting into the mood. And I get into the theater, and it starts dun, 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 and all that stuff. And so like I'm being a kid again, and I love it. And the movie was really, really, really good. The critics don't seem to like it for whatever reason. I think it's like 58% on Rotten Tomatoes, but like the fan critics is like 80 or 90 now. It's a really, really good movie, and I cared. Adam Driver, like, I hated his character. Like, I thought he was a whiny brat. He reminded me of myself when I was in high school. I was like, this dude's a punk. Like, I'd punch him in the mouth. And this movie, I like really deeply cared for some reason about his character arc, and his redemption at the end was unbelievable. Rey, like, I didn't really care about her character either, but this movie made me like, she was so powerful. She was overpowered, actually. She was so powerful that it's like, okay, like, you're awesome, like, just by default. It's like when you in Battlefront, when you got to play with Darth Vader, and you're just like, whatever you want. Like, and that was what Rey was. And it was cool. Like, I enjoyed how powerful she was. It was really good. And I think it's good for, people to see a woman, kind of being super. I mean, we've gotten Wonder Woman, other movies that have displayed very strong female leads, and I think that's good. I mean, I'm not going to get into social justice warriors or anything like that, but like, I think it's really good for girls to see that and be connected to Star Wars, because Star Wars for a long time had just been a guy thing. Not across the board, but most guys were the ones that were into it because it was sci-fi, it was nerdy. Girls aren't really into that. Only a select few. So I think it was good. I think it brought in a lot of girls. But her character, I was like digging it hardcore in this movie. The Emperor's back. I thought it was a little weird. His eyes and the way that they presented his character was a little weird. I didn't care that he came back, even though he died and Anakin brought balance to the Force back in Return of the Jedi. But like, it was fine, like it was good, and it was really, really like something we hadn't seen before. So that was cool. Poe and Zori Bliss and Finn was really, really good. I don't have anything really bad to say about those characters. The one thing that bothered me just a bit was the last act was like, it's like, okay, like, these battles are ridiculous. Like, it's so big. And like, I almost feel like, every movie has to get a little bit bigger, And like back in 4, 5, and 6, things were very compact and I mean, obviously there's a Death Star, but like, it wasn't like 7 billion ships going against 8,000 Star Destroyers. Like it's a couple ships, a couple X-Wings, like those types of things. And it was very nice and contained. There's some lightsaber fights, and lightsaber fights. Now it's this huge spectacle, and it's like, it's almost too big. And so I'm hoping that they go back to being kind of a little bit more contained universe, because it's just got too big. And it's like, whoa, if I watched that in 3D, I'd probably get a headache. There's just a lot going on. But Star Wars for me, the way it ended, when all of the Jedi are like giving all of their Force essence, I guess, into Rey to get her back up, because the Emperor had sucked all of the life force out of Rey and Kylo. She had nothing left. And so I think it's really, really, and the thing is, I knew they were going to do this. Like, I told a patient the day before, I think that the Emperor's going to suck them dry of all their Force abilities, and then all the Jedi are going to funnel them. I thought it was going to go into to Kylo or to Ben Solo, but they're going to funnel it back into them, and they're going to be able to beat the Emperor. And so they did that. They could have done it a little bit better in the movie. I think when the book comes out, it will be explained better of how that all worked. But they did a really, really good job with that scene, because I grew up with these voices that are showing up: Anakin Skywalker, Mace Windu, Obi-Wan, Ahsoka Tano, like all of these people, and it's just like, So the movie was really good, and I highly, highly, highly recommend you go watch these movies. Not because they're really good movies, or like you should get into the nerdy thing like me. It's just because they do teach some very, very good lessons, like hope. No matter how defeated you are, you can come together with your friends and family and defeat evil. That fight between good and evil, and that balance is super, super, like, it makes you think. It's not just a random criminal movie where oh, this guy robbed a bank. Oh, cool. Like, Star Wars like has deeper meanings, even though on the surface it's just a bunch of aliens and space wizards that are slinging around, laser swords. It's the deeper meanings that I think Star Wars really speaks to me. And a lot of people can't get past, they can't suspend their disbelief and watch these movies, because it's so ridiculous. It is. Like, lightsabers, never gonna happen in real life. Light speed, never gonna happen in real life. Going out in space is like commercial, like, where we can just hop in, our Ford GT and, head on up to space. with Elon Musk, what he's doing, maybe, but it's not going to happen. And you have to suspend your disbelief of this will never happen, and just say, you know what, this is in a galaxy far, far away, and let's just watch this for what it is. Let's not try to make this some Earth-based, like Star Trek. Star Trek tries to, bring in Earth elements into their shows and TV, and into their movies, and it's like, yeah, it's different from Star Wars, but you're trying to get us to feel something that, oh, this could be possible. No, Star Wars is never going to happen. Okay. That's why we watch it. Okay. So make sure that there's a good lesson to be learned. And if you don't have anything good to teach us, don't make a movie. Don't just put something together and spit it out. I will probably watch this movie 5 or 6 times. My wife will hate me for saying that, but there's just so much. And I guess the one thing to just wrap all of this whole thing up, it doesn't matter what you like. My wife likes Hallmark movies. I like Star Wars movies. I think the big thing that we need to understand is that entertainment can't just be escapism. It can't just be escapism. If you just watch entertainment to get away from your stressful job or marriage or kids or whatever, it defeats the purpose of why escapism is so powerful. Star Wars makes me think. It makes me ponder, like, that fight that we all have, the light versus the dark, and making right decisions based on, me being a Christian, and is this something that I should do or is it not? And that battle is something that we all struggle with, and it just speaks to me. So what I always encourage people, like, that don't have something that they watch, like, find something that speaks to the deeper meanings of life, not just vegetate for 20 minutes or 2 hours on some dumb thing on YouTube or dumb movie. Like, make it mean something, and that's why Star Wars does for me, and I think for a lot of people. And so movie was great. I'm gonna give it a 89% out of 100. Like, I'm gonna go watch it again, hopefully tonight, maybe. I'm gonna watch it again, and I'd like to give it a 90 or above, but it's right there where the audience score is, the 88, 89 range, and I highly recommend it. But if you have not watched any of the movies, don't go watch the last one first. You will be so confused, and you'll be like, this is dumb. Go back, and they're on Disney Plus. 1, 2, 3, 4, 5, 6, 7. You can get 8 at Redbox, and then 9 in the theater. You will spend about 24 hours doing it, but it will be well worth your time. All right, you guys have a great rest of your weekend. Christmas is next week, so I won't be doing an episode next week, but the following week after the new year, we'll reconnect on the AskDrG Show. Hope you guys have a great one.